Hi everyone, in this presentation we will be covering person-centered care processes, focusing on direct patient care activities. Person-centered care is frequently used within healthcare, although its practice and definition varies depending on establishments, research and policies. Over recent years, the focus on patient-centered care has been emphasized due to poor care provided by individual establishments, such as Mid-Staffordshire NHS and its subsequent abuse of clients. A popular framework for person-centered nursing was developed by McCormack and McCain and consists of 4 domains: prerequisites in the care environment, which both focus on addressing the way in which care is delivered; care processes, which indicates the delivery of care to the patients; and patient-centered outcomes, which evaluates the efficacy of the framework. What is person-centered care? In the same study of McCormack and McCain 2016, the patient-centered care process is defined as treating people as individuals, respecting their rights as a person, building mutual trust, and understanding and developing therapeutic relationships. Person-centered care is about recognizing that patients you care for are people, and they should be treated as individuals, not just be defined by their disease, for example, someone with COPD or someone with diabetes. This process is conducted through a range of activities which includes 5 key components. Working with the patient's beliefs and values. Sharma 2015 illustrated that the role of health professionals is to seek and understand the necessary requirements, cultural beliefs and desires of patients, and incorporate those needs into their care so that the care is more relevant to them. Furthermore, the nurses must have a respectful behavior towards patients' needs and wishes. Competency 2.1 of Nursing Midwifery Board of Australia 2010 makes the point that it is important to make sure that the nurse should not impose their own personal values and attitudes towards the care of patients in order not to leave the individuals feeling unsafe and discriminated. Engagement. It occurs when the nurse and patient engage in the delivering and receiving of care processes, and the values of both the nurse and the patient are present in the care. Sharma 2015 reported that it is essential to get patients and their families actively involved in the person's care and see their involvement as a vital part of the person-centered care process. Besides that, healthcare providers should be aware of their anti-engaged attitudes, such as labeling and withdrawing. Having a sympathetic presence. Having a sympathetic presence is defined as a way of being with patients that is consistent with person-centeredness, but is also achievable in the practice context. This requires a nurse to be attentive and available to their patient, and to obtain a sympathetic understanding of the patient's losses and present limitations, to establish a therapeutic relationship between the nurse and patient. It is also important in having a sympathetic presence that the nurse gets to know about the patient and has a deep insight about their values and cultural beliefs in order to achieve an expected outcome. Sharing decisions.
So this person isn't an inconvenience. They are not a box on a list to be checked off. You are a part of their life now. Your words, your face. So take that seriously and recognize the importance of your role. And respect the fact that that person's pain is the biggest thing in the
Firstly, let's discuss what leadership is. Leaders are often described as having the desire to direct or guide teams to a future goal by using problem-solving processes. They are often passionate, future-focused, and seek to inspire change in others. So let's ask ourselves, why is leadership in nursing so important? Nurse leaders are often seen as role models to less experienced staff. Their aim is to engage, inspire, and support the development of our future nurse leaders, and to work to ensure the continual delivery of excellent direct patient care. In contrast, identifying and developing nurse leaders is a challenge in itself, as the nursing profession does contain negative and informal leaders. The first leadership challenge we've identified to providing direct patient care is the clinician's inability to work with the patient's beliefs and values, provide holistic care, engage and develop rapport with patients, possess a sympathetic presence, and promote shared decision-making. As a result, nurses may find it difficult or are unable to apply person-centered care processes effectively in real-world practice. This includes nurses focusing on the patient's problem or a particular task, which may remove the focus from the patient as a whole and does not provide meaningful opportunities to consider the patient's experience, values, needs, and choices in the care they are being provided. Another leadership challenge for enacting person-centered care, which focus on direct patient care activities, is inadequate and unrealistic patient-to-nurse ratios. There is strong evidence that indicates the number of nurses per shift plays an important role in patient safety and delivery of person-centered care. An increased patient-to-nurse ratio does not allow nurses to spend adequate time getting to know their patients as an individual, being responsive to their needs, and providing care that is person-centered. The final leadership challenge that we will discuss is the issue of nurses lacking awareness of their patients' needs, combined with a lack of necessary skills to provide a high standard of person-centered care. This can be due to nursing leaders' inexperience when allocating staff to patients and not possessing the knowledge of how to best teach skills to ensure person-centered care is enacted. The possible flow-on effect of this is that nurses are influenced to go against their patients' preferences and pursue their own interests. So how can we as nurses avoid leadership challenges when enacting person-centered care processes in healthcare environments? The fact is, leadership challenges are always going to occur in any healthcare setting. However, if we take action and identify potential nurse leaders in their early stages and nurture them so that they continuously apply person-centered care, we can better educate nurses on taking action and implementing change prior to challenges arising. To support person-centered processes and overcome challenges within clinical practice, nurse-led innovations and initiatives have been developed and applied in various settings. Today, we explore two nurse-led initiatives designed to support person-centered care, direct patient care activities that have been implemented within Australia. The Improving Blood Pressure Control in Primary Care Intervention is a nurse-led innovation that identified adults aged 45 to 74 years with known hypertension. The study had 90 people who had uncontrolled hypertension take part. This study observed the impact of interventions that were delivered by a general practice nurse. The participants received consultations and telephone support from the nurse for 6 months. During these consultations, the nurses provided personalised lifestyle advice, action planning, health monitoring, and motivational counselling. The participants described that the nurse enhanced their commitment to maintain their health goals and enhance self-management via enablement. The nurses had the role of lifestyle coach and to reinforce lifestyle changes by repeating blood pressure measurements. The study found a significant decrease in the participants' systolic blood pressure from baseline to follow-up. It is also found that nurse-led interventions, including a step-by-step treatment plan, reduced systolic blood pressure and motivated patients to improve their lifestyle factors that were contributing to their hypertension. The second nurse-led initiative in healthcare is the Hearts First project. This program focuses on patients over the age of 45 years old that are at risk of cardiovascular disease living in rural and regional communities throughout southwest Victoria. The group of highly experienced practice nurses at 3 rural clinics worked with 21 primary care patients. The project, led by 4 nurse researchers, aims to establish the feasibility of a nurse-led program as a sustainable part of practice in rural and regional general practice clinics. The program involved a 6-month commitment to a tailored person-centered program that supports the person in the reduction of absolute risk by focusing on aspects of health behaviour the individual can change. In addition to absolute risk and demographic and clinical characteristics, other factors such as depression and health literacy are assessed to investigate how these factors may influence program outcomes. In conclusion, person-centered care processes which focus on direct patient care activities is an essential factor in healthcare, as it ensures patients and values and beliefs are considered in their care they are being provided. Person-centered care is all about putting the person in the centre of decisions which relate to their own life. It recognises that people should be able to make informed decisions about issues that are important to them. As clinicians, we must still address what are the patient's critical needs. However, with person-centered care processes, we aim to do this in the context of exploring ways by which the patient participates and plays an active role in their recovery. Focusing on relationships is pivotal to person-centered care processes, and recognising and involving other key people such as family, friends and community can dramatically be the difference between a patient surviving and thriving. In final, person-centered care has long-lasting beneficial outcomes for patients. It is proven to improve healthcare outcomes, care quality and patient experience. It is underpinned by dignity, compassion and respect, and most importantly, it enables patients to live a fulfilling and meaningful life. Is it standard practice in all healthcare environments? No, but it definitely should be. Is it worth it? Absolutely yes.